Hey there, everybody, and welcome to another edition of the Daily Mix. I'm Bill Frankmore, and today we continue our discussion with the fine folks over at the Swift Institute. Today we're speaking with Dr. Hugh McDermott. He is a board-certified in physical medicine and rehab. Dr. McDermott, thank you so much for coming in.
Thanks for having me, Bill.
All right, we're talking back pain. Give me an idea here, some of the things that people start to notice when they're back, when they've got an issue, and it's time to seek medical help.
Sure. We do very conservative things first. Very often people go see a chiropractor, try some physical therapy, your regular ibuprofen, things like that. But sometimes it's not enough, and there might be something deeper structurally going on that needs to be corrected. Myself, I do injections, things of that sort to try and help with pain with the spine, as well as other joints and things of that nature. But once it gets to that point, sometimes people do require a surgery, and it is totally necessary at times. Not always, but at times. And what we're going to talk about is spinal cord stimulation, and
a lot of people don't know about spinal cord stimulation.
Yeah, it's got a lot of old wives' tales that people have misconceptions on, and then also they just don't know about it at all. It isn't first-line treatment that we should be doing for people who have problems with back pain or pain down their legs, but is certainly an option after you've started to exhaust some of these other treatments and they're not getting you where you want to be.
Give me an idea of what is involved with this type of treatment.
Sure. So there is, it would ultimately be an implant of a device. That device has a very small battery. A lot of them now are the size of your standard business card, and maybe the thickness of a few quarters there. And then it has a couple leads or wires, but technically they're just these plastic leads where there's metal contacts on top of them. That ultimately gets placed in your spinal column on the back part where the pain signals come through, and they come through from the tips of your toes to your low back, and then they get sent up to the brain. And what those metal contacts do with the energy coming in from the battery and the program settings with these devices is it's trying to jumble up the signal that's coming from the back, from the feet, to essentially distract that signal that's
the nerve pain signal.
Oh, it could be nerve pain. Vast majority of it's nerve pain. There could be a mechanical issue too. That's just, we get people, the primary candidates for this are people who've had back surgery before and are still having issues. That's majority of what we see. There's other people who have a really unfortunate diagnosis called complex regional pain syndrome, where you have an ankle fracture or something along that lines, and then your whole leg blows up, and it's an ugly illness, but it's actually FDA approved for this. Diabetic peripheral neuropathy, so people who have diabetes and have that numbness and tingling to their feet, that burning and painful sensation, that's another one that's really common in the community that is undertreated, I would say. And most of that's because they go to see the podiatrist, their feet hurt.
Yeah.
But really it's an issue with the nerves, and they need a stimulation to address that problem. The podiatrist can't do anything for that.
So in general, usually this is something that happens after surgery. You've tried everything else.
Correct.
You get this in. And then you mentioned that this particular treatment, it has certainly evolved over the past decade or so.
For sure, yeah. So the biggest key being the technology's improved, and they're still pouring millions and millions of dollars into making it better and better. And I think in the next 3, 4, 5 years, we're going to see, again, exponential improvement in that technology. Biggest thing being the batteries are smaller and smaller. So if you're out there and you have an old one and it's like the battery really bothers you or it's running out, the newer batteries are smaller. You're not going to really notice them at all. And then the anchoring system is better. So it used to be that if the leads weren't where they're supposed to be, they could move. And that came down to how not optimal the anchoring system is. It's so much better now. It's just like if a spinal surgeon placed it, as if someone like myself as an interventional pain.
Okay. And then what's the rehab for this, or how long is this going to take to heal from?
Yeah, great question. So there isn't really a rehab component to it, but what we want our patients to do is to relax for like a month to 6 weeks.
Okay.
What it really needs to do is scar down. So we talked about that lead migration, or the leads moving. If they move, then they're not going to be in the place we want them. So then the technology is not going to work. So that scarring down, we actually want that so it holds it all in place. And your body does that over the series of that first 6 weeks. And then after that, there's no restrictions. You know, you can go about however you want to do your thing.
Okay, very good. Thank you very much, Dr. McDermott with the Swift Institute. Give him a call if you have any questions about this procedure. And we'll see you next time on the Daily Mix.